But there's good news and there's bad news. Which one do you want to hear first? Good or bad? Bad? All right, the bad news first. Okay, let's break it to them. The bad news is that disc injuries are considered chronic injuries. This means that it's something that you have to deal with for the rest of your life. But wait, there's also good news. Just because you have a disc injury or a chronic injury doesn't mean that it's something that should be causing you pain every single day. In fact, we like to say that chronic injuries, like disc injuries, are like an active volcano. Most of the time, they lie dormant with no signs of activity. But you have to be careful because at any minute, that volcano can erupt and go boom! I'm Dr. Jesse Cease, chiropractor and owner of Cease Family Chiropractic in Waldwick. And this is my adorable co-host, Braley, our chiropractor in training. We believe that education is how you gain power over just about every condition that poses a threat to your health. Our plan is to educate you on ways to keep your volcano lying dormant and reduce the risk of your volcano erupting. How's that taste? Yummy? All right, guys, I hope you like my whiteboard for today. Let's dive right in. This is Braley's whiteboard, needless to say. It used to be mine. Just kidding. It was never mine. But let's dive right in. So let's talk about disc injuries. So disc injuries are very common, but not as common as you would think. Okay, not a very common cause of low back pain compared to other potential causes of low back pain. So I'm drawing the spine here. This is the front here. So first off, in order to understand an injury, you have to know what the heck it is we're talking about. What is the disc? Where is it? Why is it important? Okay, the disc lies in between two vertebrae that lie directly on top of each other. Just to be clear, this is a spine as if you were standing in front of this board facing this way. Okay, so if I was looking at your left ear and you were facing this way, this is your front, this is your back. Okay, the disc is right in the center there. This picture is if I was to take this picture, look down at like a telescope. This is what we see. This is like a standard MRI view. So this is what we look at to see when we see an MRI. Excuse me. So the disc here, we like to use the analogy all the time in our office that the disc is like a jelly donut. Who doesn't like donuts? Okay, so it's a hard outer casing. Okay, nice little jelly-filled center. Okay, which makes this joint very unique in the body because most joints in the body are fluid-filled. All right. The knee, the ankle, any really mobile joint in the body is fluid-filled. And if you've ever sprained an ankle, you know how a fluid-filled joint reacts to injury. It puffs up like a balloon, right? The disc itself is more of a jelly-like substance, so it doesn't necessarily react that way. So why is the disc important? Why can it cause pain? Well, think about what lives right near the disc, okay? This is the spinal cord. The spinal cord is an extension of the brain. Very, very, very important piece of your anatomy, all right? So off of the spinal cord, we have all these nerves that come off and form what we call the nerve root. And these nerve roots go off to different areas of your body, right? So if it's in your low back, it'll go down your legs and form what we call the sciatic nerve. Or if this is a cervical segment in your neck, it'll go down into what we call the brachial plexus and go down in your arms into the median nerve or your fingertips. The median nerve is very responsible for what we call like carpal tunnel. Very common condition. A lot of people know what carpal tunnel is. So there's 3 different types of disc injury. Okay, let's draw our spinal cord up here. So the spinal cord runs down like this, right? And it has nerve roots coming off of it, heading down. Same thing up here. So this would be another segment up here, right? So you kind of imagine the spine. I'm not going to draw the other discs. But so you could kind of see what we're working with here. So it'll come down, right? These are our nerve roots here. So what's the job of a disc mechanically? Well, the job of a disc is to handle what we call compressive forces. Actually, I'm going to ditch this vertebrae here. So the job of a disc is to handle compressive forces. Okay? So we stand up, we run, we jump, we got gravity, the big G, pushing down on our spine all day long. So our spine and our disc is designed to handle those gravitational forces. This way the body doesn't kind of jam in on itself, right? So the job is to handle compressive forces. But what if our posture stinks? Instead of, maybe we have a little bit of weight up front, right? And we start to develop more of, I'm not going to redraw everything, but belly here. So the spine is kind of being pulled this way. And maybe the gravity's coming in like this now because of our stomachs kind of pulling everything out this way, right? So what's that going to do to the disc? It's going to force this back. So then we develop our first injury on our list, what we call a disc bulge, right? So now the disc tends to just, jelly kind of shifts to one side here. The disc tends to bulge out towards the back here. So but down here it would look like this. So we would see the jelly kind of just bulge out. I'm trying to work on my colors the right way here. So, and then we got here. Okay. So jelly's still in the donut. Donut's just really changing shape. Okay. This is a very, very common condition here. Okay. In fact, 80% of disc bulges, they say, are asymptomatic. So what that means is patient walks in and they say, oh, I've had this pain in my back. I heard it when I was getting out of my car yesterday. My doctor told me I have a bulging disc, so that's what it is. A lot of times that's not the case. A lot of times that pain's more muscular in nature, or maybe it's coming from a different joint in the spine. But a lot of times the disc bulge isn't the factor in the pain. It's just kind of there, and it is a chronic condition that we have to keep on top of because it can progress into what we call a disc herniation. So the first injury we have is a disc bulge, right? And then if we don't take care of our disc bulges, then they turn into herniations. And then if we don't take care of our herniations, we could get a complete rupture of the disc. So a lot of times patients use these words loosely, right? Like, oh, I have a herniated disc, L4, L5. Well, do you have a herniated disc, or is it a bulging disc, or is it a ruptured disc, right? What are we dealing with? So the patient doesn't really understand the difference between these three conditions, and they're three totally different conditions with really three totally different prognoses. So the bulge like this is just the result of, like we said, it's just a result of poor biomechanics causing the jelly to kind of shift to one side of the joint there and kind of causes bulging out. So what happens if your biomechanics that cause this disc bulge tend to stay poor, or maybe they get worse? Maybe we put on, the freshman 15 or the freshman 30 or whatever, or, you're quarantined for 3 weeks, right? Something happens that causes that curve up front in the belly to kind of pull everything even farther forward. Now we put ourselves at risk for what we call a disc herniation. Okay, what a herniation is, it's actually like if the jelly leaks out of the donut. Okay, so it's like if there's a slit in that donut. Okay, and the jelly just kind of leaks out of it. Okay, and now it's leaking in, and what's it touching? Okay, so notice before when we have, so I'll draw a disc bulge on the other side. This way we could just kind of compare the two. So we kind of get a disc bulge on this side, right? So this is a bulge. This is a herniation. I'm sure you could read my chicken scratch just fine. So a bulge, right? So this is pushing up. This is what I mean by when I say it's mechanical in nature. So this is mechanically pushing up. It's just causing less space for this nerve root to exit. The good thing is this nerve root is a very dynamic structure, and it's sitting in what we call spinal fluid, right? So it's able to actually just kind of alter its path. So the nerve root kind of comes together. Now I can just kind of go up and around. So it still has the potential to cause pain because it compresses that nerve root, right? That's like the pinched nerve we hear a lot of times can be caused by a disc bulge, or pinched nerve could also be caused by another joint in the body called the facet joint, but that's a whole nother video. So, but back to herniations. So don't want to get too far off track. So herniations here are totally different. So this is mechanical in nature, causing mechanical compression of the joint. This is more chemical in nature, because now you have this jelly inside the donut here leaking out into where the nerve root lives and the spinal cord lives, right? And in that little sac that these structures live in is what we call spinal fluid. Have you ever had a spinal tap? God, I hope you haven't. Those are no fun, but that's what they're going in to get. Or like, this is probably a little bit more relatable. So when you get an epidural when you're pregnant, they actually come and they inject right in here into that spinal fluid, right? So that spinal fluid is a chemical substance that doesn't really agree too well with the jelly. So when that jelly makes contact with the spinal fluid, it causes hell. A lot of pain for the patient. This is all painful, extremely painful, and this activates what we call the inflammatory process, okay? So inflammation starts to occur, chemical inflammation. This is totally different than mechanical pain, okay? So mechanical pain, if we figured out that oh, this is just bulging up against this nerve root, then let's make sure this joint is moving properly. This way, this nerve root has enough room to kind of maneuver around that bulge. But once it progresses into this chemical pain here, totally different animal, okay? So just difference in symptoms here. So usually when a patient presents with a herniation, they like can't walk into my office. They're like, you know, in excruciating pain, 8, 9, 10 out of 10 pain. Usually they'll hear like a pop, right? It's just a nasty condition. A lot of times also what we'll see with these patients, they'll have pain down one of their legs or their arms, depending. So if this is in the neck, say, right? And this is the left and this is the right. So this would probably result in pain down the left arm if this is in the neck, or down the left leg in what we call like a sciatica, if that was in the low back, excuse me. So this chemical pain here is no fun, right? Patients are in excruciating pain, and the bad news is, because it's chemical in nature, I can't provide that immediate relief that maybe I can provide with a disc bulge, right? Because disc bulge is more mechanical in nature. So my job as a chiropractor is still to restore proper mechanics of the joint so that this doesn't get worse, but you actually have to just wait this out, unfortunately, with rest. Ice usually we recommend, sometimes even gets to the point of bed rest, and the body will start to form scar tissue there to stop that from progressing. So usually what the patient presents in what we call the acute phase of care, they're like an 8 out of 10, a 9 out of 10 on a scale of 1 to 10. And then all of a sudden, a couple days, maybe a week down the line, if they listen to our recommendations, they're down to maybe like a 4 or 5 out of 10, and that becomes more mechanical in nature. And that's when we can really go in and start restoring the proper mechanics of that joint. But that's usually the presentation when it comes down to herniations. And like I said, herniations are no fun. So if you ever hear, like if you've had a herniation, you've had herniation. I don't think you'd be asking yourself, I wonder if I've ever suffered from that, right? So this is kind of the second stage of disc herniation or disc injuries. The third is the absolute worst, okay? So if we don't treat our herniation, the body will... So actually, let's backtrack real quick. Sorry, with the herniation, the patients with herniations, so they're in this excruciating pain right at 8 out of 10 right away, then they drop to a 4 out of 10. Then because the scar tissue's here, they might not feel it for years, right? So they might have been like, maybe in high school, you had a football injury, you herniated a disc in your low back, and you were in excruciating pain in high school, and then, you totally forgot about it because, you're young and dumb, and then, you go and you lift, you start doing deadlifts at the gym when you're, my age, 30, and all of a sudden, bam, you just reopen this injury, right? And now more jelly starting to leak out of the donut, right? And then we start to get scar tissue forming down here. So it's definitely an issue that once the pain's gone doesn't mean the issue's healed, right? So it's still something that we want to make sure that joint is functioning at its utmost capability to reduce the risk of this continuing to happen and the jelly just leaking out and causing this to kind of reoccur and reoccur and reoccur. But let's say you're just like, oh man, I had a disc herniation, L5S1. Usually like once a year, it tends to kind of flare up on me. And then I'll have it'll hurt for a week and then I'll just rest. The jelly continues to leak out, right? But then it just kind of goes back, right? So eventually that whole joint will just kind of give way, right? And we'll start to get what we call a prolapse. What a prolapse is, there's just no more jelly left in this donut. So we have a complete rupture of this disc, right? And all that jelly now is into this over here, okay? This is bad news. Very, very bad news, okay? So this is a pretty severe condition. A lot of times these conditions do end up becoming surgical, but we do always recommend trying a conservative trial of care before you seek surgical consultation. So if you know you suffer from a rupture or prolapse, you should absolutely seek consult with your local chiropractor to kind of get this really looked at. So a prolapse, and what happens with the prolapse is now this jelly, you're getting that chemical pain from the herniation, we're getting the mechanical pain from the bulge, and we're also getting a whole new condition with this jelly or scar tissue as it begins to heal, starting to compress actually where the spinal cord is. So now instead of getting pain down one of the legs, we're actually getting pain down both of the legs because we're hitting the source, right? So it's irritating this whole area and sending those pain signals down the legs. So we get bilateral, both sides, radiating pain down the legs or down the arms if it's in the neck, but a lot of times it's in the low back. And what that causes is what we call something called stenosis, okay? So lumbar stenosis occurs when there's irritation, there's narrowing of the canal where the spinal cord lives, and it causes this shooting pain down the legs. A classic sign of stenosis is what we call shopping cart sign. And the reason they call it shopping cart sign is a lot of times patients will actually present and say, I'm fine when I'm sitting, I feel great when I'm sitting, but when I get up, if I'm walking around the grocery store, I'm in a lot of pain, but I have to lean forward onto my cart. That'll really help the pain. So what happens is we actually lean forward and it relieves some of the tension on that disc. And that's a classic sign of lumbar stenosis. So if you have any types of symptoms like that, that's absolutely something that you should seek consult for. One more thing to mention here, this can cause a very severe condition called cauda equina syndrome. Okay, so if you know you have lumbar stenosis and you start to get what we call saddle paresthesia, extreme numbness and tingling in the groin area. Like if you were to sit on a saddle, the area of your body that would contact the actual saddle, if you get numbness in there, or if you get incontinence, you just lose the function of your bowel or bladder without knowing, that could be an emergent situation. So if you know you suffer from lumbar stenosis and you tend to have those types of symptoms, or if those symptoms just progress, you should seek emergency care. That's actually pretty serious stuff. So the moral of the story here, disc bulge, very, very common, not very severe when symptoms come into place, but if left untreated and you let the biomechanics of that joint just continue to kind of get worse, or you don't correct them and start working back towards normal, they're just going to progress down this line. Right? And that can become very dangerous and lead to conditions that are not very much fun.